Hi, everyone. Welcome to Living with Mortality and Finding Meaning. We're going to get started in just a minute. Hi, everyone. Welcome to Living with Mortality and Finding Meaning. My name is Christine Benjamin, and I'm the Breast Cancer Program Director at SHARE. But before the presentation begins, I'd like to tell you just a little bit about SHARE. SHARE is a nonprofit organization that has been helping people through breast, ovarian, and uterine cancer for the last 44 years by offering the support of those who have been there. SHARE offers many services, including a helpline, support groups, and educational programs. All services are free, charged to participants. For more information, visit our website at sharecancersupport.org. We'd also like to thank NYU Langone Health for collaborating with us on this webinar. All participants will be muted during the presentation. When Victoria and Dr. Shah are both finished presenting, we'll begin the Q&A discussion. You're welcome to submit questions during the presentation through the question pane in the control panel on your screen. When asking questions, remember that the presenters are unable to give specific medical advice, so please keep your questions general in nature. The webinar is being recorded and will be available soon on the SHARE website. So now I'd like to introduce our speakers. Victoria Goldberg is a helpline volunteer at SHARE and founder of the first of its kind SHARE peer-run metastatic breast cancer helpline, Talk METS. She's also a member of the Metastatic Breast Cancer Alliance. Victoria was originally diagnosed with early stage breast cancer at the age of 43 on Valentine's Day of 2004, and then again 10 years to the day with extensive mets to the liver and bones. The MBC diagnosis cut short her successful career in the investment bank of JP Morgan Chase, where she worked as an executive director, managing a team of software engineers. She now devotes all of her energies to volunteering and advocating for metastatic breast cancer. 5 years ago, Victoria and her husband, Paul, fulfilled their lifelong dream of making a permanent move from Wayne, New Jersey to the Upper East Side of Manhattan. She never forgets she is living with an advanced disease, but it's no longer on the forefront of her life. Dr. Akash Shah, physician faculty member, is board certified in family medicine and board eligible in hospice and palliative medicine. Dr. Shah completed residency at St. Joseph's Family Medicine Residency Program in Phoenix, Arizona. He proceeded to complete a fellowship in hospice and palliative medicine at Montefiore Medical Center. He is currently working with both the supportive oncology division at the Laura and Isaac Perlmutter Cancer Center and the inpatient consult team at Tisch. Dr. Shah's interests include resident and fellow education, as well as the intersections of emerging technology and medicine. The rest of his time is spent on the couch with his wife and handsome dog Buddy, watching HGTV and imagining their dream home. I'd like to welcome Victoria. Victoria, would you like to turn on your webcam?
Did I?
Yes.
And you can see me.
I can see you.
And nobody else, I can't see myself. Is that good?
I think it's fine. If you're having a problem seeing Victoria, let me know in the chat section in the control panel.
Okay, good, good. I'm glad I don't have to see myself. So, hello everyone. I'm so glad to be here. And basically, Christine told my whole story already, so I really have nothing else to add. But I have to say that when I was thinking about this talk and thinking about what's going on outside, literally outside of my window in this country today, I felt that anything I would say is a little trivial, don't you think? And so I'm honored and humbled that you came to this talk and you're spending time listening to me, and I'm hoping I will not disappoint you. So to be quite honest, and I want to be honest right away, when Christine and Maggie came to me a few months ago, which seems like a century ago now, and asked me if I wanted to participate in this important event, I was actually a little surprised because I wasn't really considering myself a deep thinker, a person who thinks a lot about the meaning of life and my mortality. But at the same time, I'm living with metastatic breast cancer. I'm almost 7 years out. So in a way, I am living with mortality and facing my mortality every day. And also, if I were to say what I'm an expert in, I would honestly say that I'm an expert in talking about myself. So given that I have an opportunity, an uninterrupted opportunity to talk about myself for 30 minutes, of course, I said, I will gladly do it. I didn't tell them at the time that right before this request came in, my metastatic support group at Memorial Sloan Kettering had a book club where we were supposed to be talking about a pretty amazing book by B.J. Miller, A Beginner's Guide to the End. So I enthusiastically told them at the time that I would be a part of this group, and I downloaded the book, but I was a no-show. So since then, I have read the book, and I can attest that this is a great book to read. But when I made a promise to Christine to participate, I didn't even bother to read the book. So where do I begin? So I guess I will begin at the beginning. And my beginning was, as Christine mentioned, on the Valentine's Day of 2004. It was a rainy, miserable day. And I guess I had nothing better to do but to go to my regular appointment with my gynecologist. So off I went, and during the breast exam, she palpated something. And she said to me, you better go and check it out. So I heard her, but didn't pay any attention at all, because I had it on the best authority that women my age, and I was 43, do not get breast cancer. Also, I had no history of breast cancer in my family, so obviously I wasn't going to get breast cancer. And I had a scare 3 years before this with the same doctor, who told me that I may have an ovarian cancer that turned out to be nothing. It was just a dermoid cyst. So I thought, okay, this is going to be another one of those. So I went to my mammogram and ultrasound, and things started to turn from it's nothing to maybe it's something to probably it's something to finally a call from a surgeon. I was exercising downstairs, and my husband comes in, and I see tears in his eyes. So he didn't have to say anything at all. I knew this was not good news, and the news was not good. So after that, the next few weeks were a complete blur. I can't even recall what was going on. I didn't think of my mortality. I didn't think about my reason for living. I was just going from one appointment to another, from one doctor to another, from one surgery to another. I wound up having 5 surgeries, and from a single site cancer, it became a bilateral cancer, and on it went. But I was pretty comfortable with feeling that this was one of those things that has to be taken care of. I had one panic attack though when I took a look at the book by Dr. Susan Love, and where she said that people even with very early stage who have HER2 positive disease have poor prognosis. I never thought for a minute that I had poor prognosis, and this really scared me. But luckily for me, I found the most wonderful oncologist, the best person, who promised me that I would be okay, who promised me that he would take care of me, and I believed him. So I started my treatments, and they did tell me that I was going to have the most aggressive type of treatment, and that was fine with me. The more, the better. I would have 10 years of endocrine, and I would have 5 years of tamoxifen and 5 years of AI. That was okay too. And then I would have a year of Herceptin, even better. So I started with my treatments, finished my treatments, couldn't wait to finish them. It was done, over, finished with. I went back to work. I remember very well my first day back at work. I came in, I was not used to, I had to commute about 4 hours a day to my work. And after having taken a little break from my work, that was hard. But I did wake up as usual at 6 a.m., got up, took my bus, got to work, thought that everybody was looking at me and thinking, oh, look at her, poor girl, poor cancer girl. But it went well. Nobody cared. I worked my regular 12-hour day, went back to Port Authority. As usual, the line was a block long, so I had to wait with my wig in the hot Port Authority for an hour or two. And so that was the beginning of my life back after cancer. And so days went by, and then days turned into weeks, and weeks turned into months, and then years. And then 2008 came, the financial crisis. The company I worked for was the biggest culprit and the first victim. I worked for Bear Stearns. I was managing director at Bear Stearns. The company was absorbed by JP Morgan. So it was at that point not a matter of physical survival. It was a matter of survival professionally. And I survived. I worked really hard. I was proud of my accomplishments. I don't think I loved my job. I'm sure I didn't love my job, but I liked and loved the way it made me feel. I defined myself through my career. I liked being appreciated. I liked getting promotions. I didn't mind the money I got paid. The hours were long. The job was grueling and very stressful, but I truly, truly moved on. I forgot about my cancer, never thought about it, never paid a minute's thought to it. And then 9 years later, I missed the symptoms because I thought they were stress related. My job was very, very hard at the time. So I honestly didn't think that it could be cancer. First, because I thought that cancer doesn't start around my stomach area. That's where my symptoms were. I was certain that it would be in my bones, which is funny how we know so little about our disease. And of course, I was wrong. It was in my liver, and the symptoms were getting worse and worse and worse. So finally, in the beginning of January of 2014, my husband told me that we should go to my oncologist because he was really my primary doctor at the time. So we went back to my oncologist, and sure enough, after the scan, he called my husband, and again, it was my husband who had to listen to this, and says to him that yes, it is cancer. Yes, it's in her liver. And yes, we need to start treatments right away. And his usual will take care of it. My husband comes to me, and by then I already kind of had a feeling what was going to happen, because by a pure mistake, my endocrinologist had let it slip a week before that my cancer markers were completely through the roof. So I had an inkling what was coming, but still, when you hear it, your world stops. And when you literally say your world stopped, it stopped moving. And I always assume that people, when they hear the worst possible news, break down, start crying. That's not what happened to me. I was so calm. I was so calm. I picked up the phone. I called my parents. I told them that something has happened. It's not horrible. It's just something that needs to be taken care of. I called my children. I told them the same thing. And so that's how I spent the first night. I realize now that that was shock. It was actually real shock because I did break down the next day. And that was the first time in my life I faced what was going to happen to me. I faced my mortality. I faced the fact that my body betrayed me. I never, ever, ever doubted my body. I was always the one who exercised a lot, who ate pretty well, who watched her weight, and this body just betrayed me, just like that. So the few weeks between the diagnosis and the biopsy were horrible, just awful, because I had nothing to do. My symptoms were getting worse, and I was looking at the internet, trying to find the answers like we all do. When I talk to my callers on the helpline, I always tell them, never, never, do not go to Dr. Google. You will not get anything useful out of there. But of course, I did not have somebody to give me that advice, and I went straight to the internet, and I found out that I only have, that there is nothing worse than liver metastasis, and at best, I have 3 years to live. That was not good news at all. So, you know, like most of us at that time, we tried to find something else. We tried to find another answer. I asked my doctor, and I knew even before I asked him that I wasn't going to get an answer. He's not the type who would ever tell me how long I had left. He always avoids this answer. He always tells me he doesn't know. It's in God's hands. And I actually now, after many, many years of living with this disease, I understand that it really is true, that we don't really know. They have a better idea, but they don't know. So around that time, I was really, really lucky. Around the time, an essay came out in New York Times. It was written by a young neurosurgeon. His name was Paul Kalanithi, and he was a brilliant young 36-year-old neurosurgeon who was diagnosed probably only a few months before me with the late stage lung cancer. So he wrote an essay that was called "How Long Have I Got?" and it was published in New York Times. And that essay made a huge difference for me because it spoke to me. Of course, now I realize many years later that what I heard in that article is a little different than what I hear now, but it was important at that time to get the information that I needed. He was talking about the fact that some of us live longer than we're expected to, that the information, that the statistics are out of date, that the curves of survival have a long tail, and there is no way to predict who is going to be on that long tail. And that hope I needed. I actually needed that hope at that time, and it helped. Then my treatment started, and I read in many internet articles that the protocol I was on was the most incredible, amazing thing. It was called the Cleopatra trial results, and it promised me that I would probably, on the average, will be able to live about 57 months. And at that time, 57 months seemed like a long, long time. So I was pretty happy with the news, and I started my treatment. At the end of the article by Dr. Paul Kalanithi, there was a quote from Samuel Beckett. It's only 7 words, and it said, "I can't go on. I'll go on. And this was my mantra for the first 10 months, maybe even more. I can't go on, but I knew I will go on. I got up, I did my treatments, I didn't feel well, I lost 20 pounds. I couldn't eat anything but overcooked oatmeal for 10 months, but I could go on, and I did go on, and my first scan showed that my tumors shrank by about 50%. That was the time when I actually found out the extent of my disease. Remember when I was first told by my oncologist that I had cancer, he only told me, well, you have mets in your liver, and he did not dwell on how many and how extensive it was. Well, it was really, really extensive. My whole liver was covered with metastases. I had tumors that were 7-8 centimeters. And I also had mets in the bones. That was news to me. I didn't know I had that. But after 3 months, my tumor shrank. And after 6 months, I got the most amazing results, that there were no tumors visible on my liver, that there were scars, but no tumors. So from that point on, I started to wake up. It took me probably another year to finally start living, not just being, not just existing from one treatment to the next, but actually being. And I tell the callers who ask me all the time, when will I feel like myself again? And I do tell them, it will take time, but it will happen. One of the things that helps a lot, of course, is the first scan that's positive, where that gives you hope that you will go on living, that you will have more time with your family, you have more time with your friends. So after 2 years, my husband and I decided to leave Wayne, as Christine mentioned. We moved to Manhattan. I found Share, and this is where I started to redefine my life. So cancer is probably the worst thing that would happen to any one of us in this life. And it's horrible, and there is no reason to diminish its effect. But in some ways, there is silver lining as well. This is the time when we can redefine ourselves. This is the time when we actually can find something that means more to us than just waking up in the morning and going to work. I read somewhere that there is a difference between a job and a calling. A job is when you work a certain number of hours and you always ask how much you can be paid for your work, and you expect to get vacations and days off. A calling is something that you don't really care about how much you spend doing. And this is how I feel about Share. This is how I feel about our metastatic helpline that was started a year ago. And I never thought that we would be able to get so many dedicated volunteers in our helpline that we can cover now easily 6 days a week, 3 shifts a day. I've met the most amazing, incredible people along the way. I have made friends for the rest of my life, the bonds that probably would have been very, very hard to make at my age. And, it's just overwhelming. But there's also the bad side. This cancer is still with us, and we continue to die, and we continue to see the young lives cut so short, so unexpectedly short. And I'm losing friends. And I keep saying to myself every single time, I can't go on. I can't go on. And then the next day, I know that I will say, I'll go on because they need me. And this is what I'm meant to do. This is my legacy. And I love every minute of it. It's hard. It's emotionally draining. And I hope to see the day when I won't have to lose yet another friend to this terrible, terrible disease. But as long as I'm needed, I will be here. Thank you.
Thank you, Victoria. We have some questions that came in for you, so we'll ask those later during the Q&A. Thank you for your presentation, for sharing your story with us.
Thank you.
Dr. Shaw?
Yeah. Can you see my screen?
Yes, we can. Thank you.
Okay. First, so my name is Dr. Shaw. Thank you for the introduction, and Victoria, that was an amazing speech. Thank you for sharing your vulnerability with all of us. I think that means a lot to people, to be able to hear your story and relate to some of the things that you've been going through. And I just want to say thank you one more time. Is this working? Is my screen shared? Okay. So the title of our talk today is Living with Mortality and Finding Meaning. And I just wanted to briefly talk about it real quick. So being confronted by our own mortality can bring up a lot of feelings: fear, anger, sadness, helplessness. And few experiences bring us face to face with our own death like a cancer diagnosis. But facing mortality can also be an opportunity to find meaning, live in the moment, and contemplate the mark you want to leave on this world. As you may have guessed, this is a very, very deep philosophical question. And by no means am I an expert. I think as a physician who's taken care of many, many people who have faced cancer, I think it's important that we hear their stories. That's why another reason why I wanted to thank Victoria. I think as people hearing stories of others that have been through similar circumstances, it can really make a difference. You may not know much about me, but I'm in my mid-30s. I'm pretty much New Jersey kid since I was 2 years old. I decided to study family medicine, and I wanted to be able to take care of people, from birth to death. And during my training, I realized that basically there's a doctor for every specialty you could possibly imagine. There's not a lot of doctors that specialize in taking care of people who are really sick and who are, facing some of these very difficult conversations. Yes, some oncologists are willing to have that discussion, but there are many out there that would really not have to go in that direction if they don't need to. I found that as physicians, we spend a lot of time talking about, details and very specific things like your creatinine and, your liver function test. And we don't often focus on the actual person. We don't focus on how their family unit is structured. We don't focus on what their goals are. We don't focus on their quality of life. It's more of a, well, just keep going, and your creatinine looks okay today, so we should do treatment. I realized that we spend hours and hours documenting and very, very little time actually speaking to patients about the things that matter to them. And that medicine was more like a factory process where we just focus on the metrics and how efficient we can be, and almost forming an assembly line to see patients, 15 minutes and your time is up. So these are some of the reasons why I decided that I would focus on patients who are very sick and who do have cancer. Okay. I found oftentimes that I am one of the first people to have those discussions with patients, especially when I'm in the hospital. A lot of times the oncology teams, they should ideally be the first one to have that conversation, but sometimes they would rather, wait to be seeing the patient on the outside of the hospital. So in the hospital, it's a different world, and things are happening very quickly, and patients can't necessarily wait weeks to get more information. So the next thing I wanted to say was that there was a very famous quote by Benjamin Franklin, and he wrote this actually as a comment on the new constitution that just passed in 1780s, right? And he said, in this world, nothing can be said to be certain except taxes and death. And I wanted to highlight this because since the moment we were born and we were first able to think critically, we all understood that at some point our time would be up. We found ourselves growing older, weaker, sometimes quickly, but usually very slowly. We've weathered countless storms and apocalyptic events, some literally, some figuratively. And every one of us has lost family members and friends and loved ones. So mortality is something that we find ourselves grappling with constantly. The tough part is then finding some sort of meaning in that, right? Some sort of acceptance. How do we cope? I feel like that's the bigger question here is we're all going through something difficult, but how do we cope with what's happening in our lives, especially something like a cancer diagnosis? I found another quote by Desmond Tutu, and he once said, suffering is part and parcel of the human condition, but suffering can either embitter or ennoble us. It can ennoble us and become a spirituality of transformation when we find meaning in it. Now, none of this is meant to take away the pain, the anger, the sorrow, even the bitterness that you might feel when you get these life-altering diagnoses. But when it comes to enduring pain and suffering, we all know that is part of the human condition. It is not a question of if we will be impacted, but more of how we choose to respond to those actions. So I wanted to spend most of my talk kind of just giving you guys stories as of patients who have gone through and are currently going through similar situations as you may be. This was about 2 weeks ago after a lot of the COVID was slowing down in the hospital. I met Mr. M. He was a mid-50s African-American gentleman. He was in the hospital for a pain crisis, but when I went in to see him, he's sitting comfortably. He's actually wearing his own pajamas, sitting on the chair next to his bed. He's got these gold-rimmed glasses. He's got a gold chain with a cross on it. And before I went in the room, I was, looking up his story, just trying to figure out, what I was dealing with or what the patient was dealing with. And it turns out he'd been having this nagging abdominal pain for about, 3 to 4 months. He thought it was gas. He thought it was, acidity. He thought it could have been any number of things, really. And he kind of ignored it, put it on the side. Ending up in the hospital for pain, did some imaging, and it turned out that he was diagnosed with stage 4 pancreatic cancer. And that, we know, and he knew as well, that the survival is less than a year in most of those patients. And he was in a lot of pain and distress. So part of my evaluation was to definitely talk about his symptoms, and we came up with a good plan for his pain and his nausea that he was having. And over the course of the next couple of days, he got better and eventually left the hospital. But more importantly than that is what else we were talking about. And a lot of that had to do with coping skills, strategies. And I was like, Mr. M, you're a healthy guy. You don't really have any medical conditions. You're in your mid-50s. And all of a sudden, a week or two ago, you got diagnosed with a terminal cancer. I mean, how could you possibly deal with this? How are you coping? You know, and he looked me straight in the eye and said, I feel like I got gypped, man. I feel like I got gypped. You know, life was going really well for me. He was telling me that he was doing well in business, that he had just been offered a new business opportunity where he would be a manager of the tri-state expansion of a food franchise. And then within weeks of getting that offer, he was diagnosed with this cancer and had to turn it down. He was telling me about his daughter who's finishing up college. He told me about his nieces and nephews who he was serving as a father figure for because their father wasn't part of their life. You know, and I asked him, how are you doing? How are you doing all this? And yes, he did feel like he got gypped. But he also said, you know, I'm a spiritual man. I pray to God. I have faith. My family is very loving and they're here to support me. I'm going to spend the rest of my life making sure that my family is taken care of and they know how much I love them. You know, and I think that was just extremely powerful to hear that, you know, there are people out there who are in even worse conditions that have even more dire circumstances. But despite it all, despite all the negativity, they're able to not only embrace it, but find meaning in it. Okay. I also wanted to briefly mention, you know, my own personal experiences. This is me and my mom. This was, you know, maybe last year. And when I went off to residency, I went to Phoenix and my whole family's in New Jersey. So that was difficult. I did long distance with my fiance at the time for 3 years, and I didn't see my family a lot for 3 years. And so it was my first year of residency, and I was, you know, in the clinic seeing patients, finishing up, and I got a call from my mom. And she just basically told me, she was like, you know, I've had some pain in my breasts, and I got the mammogram done. They said they saw something suspicious, so we went for the biopsy, and it turned out that she had breast cancer. So, you know, me being a brand new doctor, it was just immediately like, okay, tell me the diagnosis, tell me, you know, and I want to talk to the surgeon, I want to talk to everyone. And it was just, number one, it was difficult because, you know, my mom is, you know, she's my mom and she's always been there for me and she's always will be. But she had been relatively healthy pretty much her whole life. There was no alcohol, no tobacco, no smoking, no drugs, no, you know, nothing, you know, there's nothing that she felt like she was, that she did wrong, and she didn't know why she deserved this. Let me fast forward the story, but basically she ended up getting a bilateral mastectomy and then went through reconstruction. And this was over the course of my intern year. So after that was over, we were like, okay, well, you know, we're in a good place now. She was finally feeling like herself again. She was going back to her activities, went back to work. I mean, things were going okay. And then fast forward to my last year of residency, which was year 3. I was actually at home this afternoon, and I got a call from my sister. And my little sister, was just starting senior year of high school, so she was home a lot. And I knew that if I got a phone call from her during the middle of the day, it was most likely going to be some sort of bad news. And she, you know, I got on the phone and immediately I could tell there was something wrong. I mean, we've all gotten these phone calls in the past. And my sister was crying. My mom was having a seizure, and I am, you know, thousands of miles away, can't really do anything, can't really help at all, which was definitely a struggle. So, you know, I made sure that she had called 911. I made sure that I called family friends who were living in the same town over to tell them to rush over, and I called my wife, who was a physician in New Jersey, to go. And, I just felt like a lot of the time I was, there by proxy, but I wasn't able to do what I should have for her. Luckily, not luckily, but it turned out that she had a small stroke, but the reason that she had the stroke was because she had a secondary tumor growing in her brain. And ended up she needed a craniotomy within a couple of weeks of that diagnosis. And then she had to be on seizure medicines since then. Luckily, we haven't seen any growth of the tumor since then, but she has still been struggling with the anxieties, probably even depression that she's had from all the negative thinking, all the what did I do to deserve this? Why me? Why two individual types of cancers, right? It wasn't that her breast cancer had come back and then spread to her brain. It was simply another cancer on top of breast cancer. And as you can imagine, that brought a lot of questions into our lives. So we've been struggling these last 4 or 5 years, trying to talk to her, trying to get her to seek therapy, trying to get her to see psychiatry. But, at least, and I can speak to people in my family and this, especially immigrants, mental health is not a topic that is often discussed. It is often ignored. It is simply just something else you must get through. But in reality, when you're dealing with something of this nature, mental health is at least as important, if not more important, than your physical health, right? I mean, so that is definitely something that I think people need to at least start thinking about. And if it's something that they feel like they need help with, there's lots of resources, and I'll get into some out there that we can find a way to help with. So this is a screen I just wanted to show. I'm not going to read the whole thing, but I just wanted to kind of show you and some of the common responses that we get that I discussed, that Victoria discussed, that pretty much a lot of you have also discussed, right? There is, why me? What did I do? Right? There is, how will we pay for the treatments? Who's going to take care of my family? The feelings of hopelessness, regret, guilt. Oh, I should have went to the doctor 8 months ago. I should have done X, Y, Z, or maybe I should have went for that trial. There's just so many thoughts that come into your mind. And unfortunately, a lot of these diagnoses seem to come out of the blue. Oftentimes when things seem to be going well in life, it almost seems like some sort of, avalanche that just piles on top of itself. So what do we do here? What are some strategies we can use to deal with these emotions, right? And the first thing, the title is the most important part. There is no right or wrong answer, and I cannot stress that enough. There is no one way to cope. There is no one way to correctly deal with a cancer diagnosis. Every single individual has their own tendencies, their own habits, their own coping mechanisms, some of which are healthy, some of which are not. But I've been asked, what is the single most important thing that you would recommend to patients dealing with this and trying to find meaning? And just like every other doctor, I'll tell you there is no one secret, there is no one method. It's really just a matter of getting in as much information as you can and trying to keep a good attitude, right? You don't have to process this diagnosis, this conversation immediately, right? Some people are in shock. Some people, everyone's in shock, but some people cry. Some people, I've seen people laugh because of the severity. It just cannot be processed. So take your time, be good to yourself, be patient. It's going to take weeks, if not months sometimes, before you even get your first chemotherapy sometimes. Okay, so that's not a reason for you to panic. Just try to be patient. Okay. Allow yourself to feel. That's so very important. It actually might seem better to a lot of people to just block it all out or avoid experiencing emotions, but they do exist, whether you're paying attention to them or not. If you allow yourself to feel what you feel, you'll find that even the intense, disturbing, bad news often will pass. The initial distress that you felt when you got your diagnosis, it will start to ease away slowly. And some aspects of your life may even return to normal. Okay. One of the most important things I will say is that attitude, and I've said this before, but attitude is maybe one of the most important things that you personally, any of us personally can change, right? There will always be some sort of forces acting upon us, giving us bad news, informing us of, deaths in our family and our friends, global pandemics, right? There's always something bad happening out there, but it is up to us to decide how we respond to those events. I want to briefly mention that I am a palliative care physician, and it is a fellowship that is done once you finish your residency. And we specialize in providing care to people at any stage of your illness, sometimes in hospitals, sometimes in nursing homes, sometimes even in patients' houses. There is a difference between palliative care and hospice care. Palliative care can be for anyone at any stage. Hospice care is usually end of life when the physician say that there is no more treatment available, or you are too sick to get any treatment going forward, okay? But the only role that we have is to try to make sure your quality of life is better than it is right now. Some of it's emotional support, some of it's spiritual support, some of it's physical support in managing your pain and symptoms. But all of them are important, and that is definitely something, whether you're in the hospital or you have an oncologist who can recommend you to someone, it is definitely something that you can at least try to see if you feel better after. And in terms of the role, it is usually made up of a whole team. There's doctors, there's nurses, there's nurse practitioners, there's social workers, and chaplains. And there is a theory that pain is, and as many of you know, it is not just physical. Pain can also be emotional, it can be spiritual, it can be existential, it could be financial. There's so many different ways that people suffer. And we realized as a team, especially as a team that works with people in this vulnerable population, that we cannot do it ourselves with just a doctor or just a nurse. We need chaplains, we need social workers, and we need all the help that we can get, right? So we have chaplains to help deal with spiritual and social issues, social workers to help you with resources, sometimes financial, sometimes in regards to planning ahead. And then we also need doctors and nurses to help with medications. So some of the things that we provide are pain and symptom management. A lot of patients, such as yourselves, deal with physical symptoms, whether it's abdominal pain, neuropathies, anorexia, losing weight. And so symptom management is a huge, huge part of the services that we would offer. And some of these symptoms are not just from the cancer. It can also be from the treatments themselves. A lot of them cause really bad symptoms, and in addition to your oncologist, we help manage those symptoms. Some of the other things that we offer are, we do refer for massages, we do refer for acupuncture, we do also prescribe medical marijuana at times if we feel like it's helpful. And there are clinical trials regarding other medications that can be helpful for anxiety and depression. And so some of the discussions, as I talked about with my first patient, I told you guys about, a lot of what we're doing is simply listening, right? We are not here to, tell you everything, a lot of what we're here to do is so you could vent straightforward, right? We're there to listen. Most doctors have time constraints, and we do as well, but they're a little more generous. So we can sit there for an hour and listen. We don't have to be in and out of the room in 10, 15 minutes to go to the next patient. Another thing is we do refer to psychology, psychiatry, therapy, because there are forms of therapy that have shown to be helpful for patients suffering from anxiety, and also depression and other physical manifestations of symptoms as well. Another important thing that we do, and this is more so for the people out there that are planners, not everyone wants to think ahead, especially in what might be a long, difficult road ahead. But there are people, either family members, our spouses, our children, that do want to have these discussions, that do want to at least start thinking about what the road ahead is going to look like. And so we do help fill out legal paperwork in that regards. Simple things like healthcare proxies, which say, in the event that so-and-so is not able to participate, who is going to be their medical voice? Who is going to make decisions for them? And that is something that the patient can tell you, and we can put in writing beforehand. That, as well as medical orders for life-sustaining treatment, is another legal form that we help fill out that talks about wishes, especially near the end of life. And so for some people, this is not very important. They don't even want to talk about it. They don't want to think about it. But for other people out there, they find comfort in knowing that at least the framework of how their care is going to be handled going forward is set in place, meaning they're the ones guiding their care, but they're doing it in a way that their family members can take part of, their physicians can take part of, and everyone can be involved in shared decision making. Okay. This is just a collection of quotes, right? I find, a lot of times my mom sends us all every morning an inspirational quote, and this is something she does as a coping mechanism to not only help us as a family deal with this, but also to help herself. And I'm sure everyone else can relate to, these rabbit holes where we go into sometimes when we're not in a good mood, where we just browse the web and look for information and look for quotes. So this is definitely something that, you could use to get us through these things. I'm not going to read them all out, but just something to look at. Now, importantly, right, so we talked about mortality and suffering, but, how do we live with the conditions of this disease? How do we live knowing that this might be something that we may not survive, right? And I'll give you a couple of examples of patients who I've worked with who took up creative methods to cope. One started doing stand-up comedy. He has a bone marrow cancer, and he didn't have a lot of physical symptoms, but he had, some weight loss and appetite changes. And one of the things he started doing, was just a funny guy, and he decided that, if his time is short, he's going to spend it doing something that he's always wanted to do, stand-up comedy in his sense, right? He didn't really give me any good jokes, unfortunately, but that is definitely, something on the more creative end that I've seen. I've had other patients who are chronicling their disease, they're chronicling their diagnosis, they're chronicling their treatment methods, they're chronicling, most importantly, their home lives throughout this time. I don't think it was published, but this is definitely something, journal writing, these are definitely things that you can do to help cope. Some people find it by external events, like going to shows, going to Broadway plays, going to the movies, right? So everyone does it so very, very differently is what I'm trying to get across. Some techniques that we found out there that do work something like mindfulness, for example. Mindfulness has also been called Zen, it's called meditation, it's called Smriti. It has very, very old beginnings. A lot of it is attributed to Buddhism, actually. And it's the process where you were purposefully bringing attention to your experiences in the present moment without judgment, which is the hardest part. So the goal is to recognize, yes, I'm feeling angry, yes, I'm feeling frustrated, and to recognize that emotion and then move on past it, not dwell on each individual feeling, okay? There have been many articles in psychiatry, psychology, palliative medicine journals, all starting since the 1970s that have developed many applications based on mindfulness that helps with a variety of conditions. It definitely has been shown to reduce stress, anxiety, depression, and some studies showing that it can actually help with physical symptoms as well. Studies also show that rumination, worrying, that contributes to a variety of mental disorders by itself. So what we're saying is even just the thought of thinking about your cancer all day, every day, leads to poorer outcomes in patients. And that has been something that they have identified through, lots of studies as well in the past. So attitude is, again, something to keep in mind, right? Some people find solace in religion, in their faith. It doesn't really matter which religion, which faith you ascribe to, but just the feeling that there is a higher power, that there is some method to the madness, right? That feeling in itself is a huge source of support for many, many people, including the first patient I talked to you about today. I know it is something my mom does daily. She wakes up every morning, and after she showers and gets ready, she does her prayers, and then it gives her the strength to go forward and deal. Some of you may be familiar with the story of Job in the Old Testament, a man who God considered one of his most faithful subjects. I'm not going to go into the whole story, but essentially and briefly, it's a story of a man who God allowed to be attacked by Satan. He told Satan, "Behold, all that he has is in your power. Only do not put forth your hand on him." Right? So through all of Job's trials, he lost his health, he lost his family, he lost his wife, he lost his farm, he lost everything. And throughout it all, he did not blame God. He did not sin, right? And then the second part is all his friends gathered around and gave him a lot of bad advice. They told him he should blame his sufferings on God. He should not have, put this all upon him. And one of them was actually half correct in that God wanted to humble him, but this was only part of God's test. In the end, God said, "Who is it that darkens counsel by words without knowledge?" Right? Have you understood the expanse of the earth? Tell me if you know all this. So Job answers in the end, "I have declared that which I did not understand." And then his suffering was restored. I tell this story because it's another story of someone who is completely down and out, who feels that the world has abandoned him, God has abandoned him. And if you are someone who has a strong faith, a strong belief system, I think it's very, very important that you embrace that system. This is not for everyone. And if religion and faith is not what does it for you, like I said, you can focus on other things. Some people find it in their work. Some people find a calling, as Victoria said. Some people meditate. Some people practice mindfulness. Different things work for different people. Okay. One thing I wanted to look at was, we were talking about coping, and I wanted to look up if there were actually studies on positive versus negative religious coping. The Randy Herbert actually did a study in 2009 where he followed women with breast cancer for up to a year, to determine the relationship between coping and well-being. The results were as follows. There were two major takeaways. The first, which was that negative coping, which is basically saying God has abandoned me, expressing anger at God for the suffering, this was actually correlated with a worse overall mental health score, more depression, and less life satisfaction. Okay. And then the second major result was that it didn't matter what stage of cancer patients were in. If they practiced negative religious coping, they were also likely to have worsening mental health problems in the future. Okay. And these studies are actually consistent with other studies in the past that show that negative religious coping predicts worse psychological adjustment. So, as I said before, faith is a good predictor of quality of life as well when one is confronting serious illnesses. Okay. And as I've been saying throughout, positive attitude matters, whether you're thinking religious, whether you're thinking about your religious beliefs or you're thinking about life in general. Having a positive attitude is maybe the single greatest thing you can do to help get through these difficult times. And then finally, I wanted to talk and spend a little bit of time just kind of giving you some thoughts from people much wiser than myself. Viktor Frankl, who wrote a book called Man's Search for Meaning in 1946, where he chronicled his experiences as a prisoner in the Nazi concentration camps during World War II. And his book, and I'll give you a quick summary, came up with two different things. The way the prisoner imagined the future affected his longevity. That was what Frankl's basic message was. And he said two basic things. Number one, find meaning in the most dire of circumstances. He who has a why to live for can bear almost any how, right? And this is something I discussed before. Things will happen to you in life and they will continue happening, whether it's cancer, whether it's any other illness, pandemics, there's always going to be something. The important part is how we deal with those stimuli. You will always have a freedom of choice between a stimulus and your response. Therefore, attitude is the only thing that you can control. So Victoria mentioned briefly Dr. Kalanathi, who also wrote a book called When Breath Becomes Air. And that's another wonderful read, and that also talks about his personal experience dealing with an end-of-life cancer diagnosis and what that did for him and his family. Prior to that book, there was another book by Atul Gawande, who is also a physician, and it was called Being Mortal. And this is another fantastic read about, similar to what Dr. Kalanathi wrote about, how we can get the strength to move on past these diagnoses and conquer what is to come, redefine your life if that's possible, right? And one of the things he mentions is courage, and especially Plato's definitions of courage, right? Which is wise endurance, endurance of the soul, knowledge of what is to be feared and what is to be hoped. And courage is strength in the face of knowledge of what is or to be feared or hoped. So you are facing this diagnosis, but being strong, embracing it, and looking forward, that is a sign of courage. Okay. And I wanted to finish by giving you one last story. I met a patient last week in the cancer center, and I had no idea who this gentleman was. I never met him before. I never talked to him before. But turns out he was a 44-year-old male, and he was recently told, and he was suffering with a glioblastoma, which is a deadly brain cancer. and he had just met his oncologist, and he was just told that he has 3 to 6 months of estimated survival. And as I normally do, I start out by talking about physical symptoms and seeing if there's anything physical I can help with. And unfortunately for him, he did not have any pain. He wasn't having headaches or seizures or nausea or vomiting or any of those things. So generally, we talked about what he would do if he were to experience those kinds of symptoms, how he can get in touch with us, what those symptoms might indicate is happening, and possible treatment options for him down in the future if he did develop them. But next, we kind of moved on to his family, and his wife, who's also in her mid-40s, was on the phone with us. We couldn't do a video chat, but it was just a telephone call. But we were simply just talking about his quality of life and how he thought he was doing. And he said, Doc, despite everything that's been happening with COVID and rioting and my cancer diagnosis, being told I have so little time left, this is the happiest I've been in my whole life. That's what he told me. And I was like, first I was kind of like dumbfounded, as in like, you can't be serious. You can't mean that, or can you? And he said, despite all these negative things that have been happening and continue to happen, even COVID, he said that, it almost was forced family time for him in this, when his time is already limited. His whole family's home. His kids are home. His wife is home. He's been able to talk to his kids about his diagnosis, and they're young, middle, in their teens, so they don't fully understand, but they have an idea of what's happening now. And he just showed me again that when all is dark and gloomy and negative in your life, people can still persevere. People are still resilient. And it doesn't matter which technique you use to build that resilience, whether it's mindfulness, meditation, religion, your work as a calling, your work, even without it being your calling. Some people rely on that too to take their mind off things, right? So embrace what support you do have already, what foundations you have already laid over the course of your lifetime, your family, your friends, your church groups, your support groups, wonderful organizations like this today that are allowing us to share our message and talk to you and bring this information to you. So on that note, I just wanted to say thank you, and I hope this was helpful. And just remember that having a positive attitude and finding a meaning and purpose are the two things that I have found that give people the greatest chance at coping with all these negative emotions that come hand in hand with a cancer diagnosis. Thank you very much.
Thank you, Dr. Shah. I'm going to invite you and Victoria to turn on your webcam. I can send you a request to do that so that perhaps people can see you during the Q&A. Great, thank you both. Thank you for that presentation and for sharing your story. A couple of questions. Victoria, what is the book that you mentioned?
So this is a book by B.J. Miller, and it's called A Beginner's Guide to the End. And it's actually an exceptionally well-written manual about what to do and how to do it, and it's very, very useful. I think everybody should have it at some point and look at it.
So Victoria, Allison wrote, I'm enjoying your presentation so much. How do you stay hopeful, and are you spiritual?
Well, I stay hopeful because I've been lucky to have a still live pretty well on my first line of treatment. So it's, in a way, it's actually harder because my life has become now more as it used to be. I'm hopeful that it will continue to be. And I know, of course, that there will be a change, and the other shoe will drop eventually. And I'm, again, unprepared for it. And I don't really know how to be more vigilant about it. And because hope is everlasting, what can you do? But yes, I am hopeful, and I don't think I'm very spiritual, but I'm trying to be.
Thank you. So Julia is asking, what if your oncologist's office doesn't have a good palliative care team? How can you receive a palliative care consult?
Yeah, that's a great question. And unfortunately, it seems that palliative care is still rising, if I will. It's still kind of earlier stages. So there are not a lot of, not every hospital or not every oncologist has somebody. But I'll, you know, if it's helpful, I can leave my information with you and you could pass it on to the group. Maybe not, because we only see NYU oncologist patients, so that's another limitation for us. But if it's questions that I can, you know, walk you through or help you find the right information, I would be happy to talk to you.
Liz is asking, how do we preserve hope when we have dual potential cause of death looming over us? Disease, progressive cancer, and COVID-19.
Who is that for?
Well,
Whoever would like to take it.
So would you like to take it?
no problem. You know, it's a tough question. I like I mentioned, I mean, there are many awful things happening in the world right now. And it's important to have that hope, you know, right? But how you find it, that's unfortunately kind of a personal journey, right? Some people, as I said, find it in religion, in faith, but there are many people that are not religious that don't believe in that find it in different ways, right? By meditating, by talking to their friends and family. So hope, you know, I wish I had a better answer as like one particular method I would advise, but I think it comes with educating yourself, speaking to lots of people, attending these support groups, and finding what works for you as an individual.
Thank you. So Andrea is just reminding people that there's a website, getpalliativecare.org, that is very, very helpful. It has a lot of answers and information there. There's several questions about dealing with the fear of recurrence, like the deep fear of recurrence. I think you sort of answered that question with the answer to the last question, but if you want to speak a little more maybe about dealing with fear.
So this is the question to me. As I tried to explain that when I was first diagnosed, I had no fear because I was so positive about having finished with cancer, and it was just one of those bumps in the road. So I moved on without really fully understanding the extent of what I went through. But my second diagnosis was a completely different thing. There, I actually faced the diagnosis and the mortality and the fact that I will most likely not be able to live out my lifespan as I expected. But then things started to work out better, and my fear had diminished over the years. And now, as I said before, it's I'm fearful of what I'm not feeling. I'm fearful that my cancer will come back and I'm not capable of dealing with it. I feel like it's going to be another diagnosis all over again, and it's going to be this terrible, terrible feeling all over again. But you know, we live. I try to live one day at a time. This is how I always have. I mean, the difference between people who live normal life and are not sick, they know that they will die someday. And we living with the metastatic disease, we know we will die someday too. There's really no difference. The only difference is that we feel it more acutely. So what I try to do is to refocus on my everyday life. You know, in the beginning, cancer was everywhere. It was all about cancer. Then cancer became the background noise. For years and years and years, I was always aware of it being there. Lately, I realized that sometimes I don't even think about it. I have so many things that I need to get done that I can cope without spending way too much time on it. But it's a personal thing, and I know so many who can't do it, who are overwhelmed by their even early stage diagnosis. But time, I really honestly believe that time helps. The longer you live with it, the better your scans are, the easier it is to cope.
Thank you. So someone's asking about finding more meaning in life after a cancer diagnosis. How do they find more meaning in life? These are tough questions. I mean, this is
very tough. So, you know, as I said, for me, I actually found silver lining in my diagnosis. Had it not been for my diagnosis, I would have continued with my career, 12-hour work days, 4-hour commutes, just being in that lane, not thinking about a change and not seeing the world outside. But once I got diagnosed, I was given a chance to relive my life, to start all over again. I mean, how many of us do get that chance? Very few, but I did. I got that chance, and I found something that I'm passionate about, and this gives me meaning. I also try to live in a way that every day gives me pleasure, even little things. I try to find something good about it. In a good day. Every day I find something that I enjoy and that's important to me. And the meaning is what you want it to be, I think. Even, you know, some people, I was talking to a friend who's in the hospital now, and I asked her what is the meaning for her, and she says, well, I want to travel. I want to see as much as I possibly can in the short period of time I have left. And that's meaning to her.
Yeah, I just wanted to piggyback on that because, as Victoria said, I mean, it's deeply personal. Meaning is individual. It's not, there's no global or group answer to that. And that's why we're doing this. That's why we're talking about people's stories, and that's why I shared some stories with you. People find it so very differently, and you know, some people. I think it would be helpful if you're not sure to, you know, at least start by journaling or documenting things that do make you happy, that do give you meaning, and you can build off of those things in the future. But at least discovering what that is, I think that should be your most pressing task, is to find what makes you happy, right? Some people, it's just taking things day by day and, you know, chore by chore or something. That's what my mom says. And that brings people happiness, right? Just doing their daily activities without changing, that makes people happy. So for some it's that, for some it's, you know, sports, for some it's religion. So trying to discover yourself and what actually gives you meaning, and being open to trying different things, and maybe you'll discover that you do want to do some of these other things, like traveling or even praying.
So I have a couple more easy questions for you both. It's one thing to face our own mortality, but within the Metastat community, we're constantly seeing our friends progress and die. This feels like an especially complex form of trauma. Can either presenter talk about the importance of tending to grief, or talk through different strategies to work with grief that is ongoing and collective?
Okay, I'll go first, I guess. She can tell you a little bit more personally, but I've been doing this job now, I guess, almost 2 years, and in that time, I've seen, I've developed relationships with many patients, and the vast majority of which have passed, and it's difficult, it is almost a PTSD of sorts. You find yourself thinking, like, random moments in life will bring back memories of these people. Random conversations will trigger them. And it's very, very important to take care of your mental health. Some of it's due to our own illnesses, our family's illnesses, but not getting proper treatment, or even talking to someone, right? The first step is opening up and talking. And that's why this wonderful organization exists, to at least share that information with each other. Even if you don't go to a doctor and get medication for it, the most important thing is to try to accept it and talk about it. And when you do accept it, then you can actually make changes in life. But the first thing you'll need to do is try to come to terms with it and try to seek help. And in terms of help, there's many different directions you can go. There are therapists to talk to, there's medications to try, there's lifestyle changes to attempt, but I think the first and most important thing is communication and opening up to somebody, whether it's family, friend, or just somebody on a hotline who's willing to listen to your story and give you information without any judgment.
Victoria, do you want to add anything?
Yes, I actually do. So, I've been living with this for a very long time, and of course, because of what I do at Share and my support group at Memorial Sloan Kettering, I have lost so many close friends, so many, and there's always survivor's guilt. Can't help but feel, why am I so lucky and I'm living when these wonderful women are no longer here? But there are also some practical things that we can do, and I'm very lucky about being a part of an amazing support group at Memorial Sloan Kettering. So when you join a metastatic support group, you're always faced with this dilemma. On one hand, you want to have a bond and friendship with women who are going through the same diagnosis as you are, but at the same time, you realize that along the way you'll be losing your friends. But we have found I think a working solution. And in this last year, we've lost a number of wonderful, wonderful women. So in our support group, we started doing these memorials where everyone comes together and we talk about the person who passed and anything else we want to talk about. And that helps a lot. And we also have another practical thing, and I think I can talk about this. We just got a tree in Central Park. It will be our memorial tree for our group, where we will be able to go and think about our friends and remember them. And, you know, as they say, you don't die if somebody remembers you. So this will be our way of remembering those who have gone before us.
Beautiful.
And I would just like to add that, you know, when you're dealing with compounded grief, right? So if you're living with metastatic disease, for example, and you have a bunch of friends that have died and it keeps happening, right? I mean, the nature of the disease is that this keeps happening. And so that's compounded or complex grief. But the other thing that happens at the same time is that it brings up your own anxiety and grief about your own life, right? And so a good therapist can help you sort of tease out those issues and unpack them all and sort of deal with each individually. And there are some really terrific grief counselors out there. Not everyone is a good grief counselor, but there are some really excellent ones that can help. So Danielle writes that she's struggling with finding something that can be her legacy when she's gone. Do you have any ideas?
Well, I have an idea for me, and I always welcome new people to come and join me. Maybe that will be a legacy for you as well. But it's hard. I don't actually know how to answer this question.
So, you know, I know Danielle. Danielle, if you're still here and you're listening, I mean, I think you give a lot to
Is that it's our Danielle?
I'm just saying Danielle, yes. And she gives an awful lot to this community and works on the helpline and gives, you know, double shifts on the helpline, works on both the early stage and metastatic helpline, you know, giving of herself selflessly. And so, Danielle, I don't think that you can underestimate the number of women that you've helped over the years and the role that you've played in their lives. So I hope that helps.
There is an organization called the Legacy Project, and they should have their own website and everything, but sometimes, I mean, it just really depends how you want to do it, but they have like kits that they would do. Some people like to leave recordings or videos or letters, or some people, you know, in the hospital, sometimes they do handprints. I mean, it just really depends on who you're leaving this to, what you're leaving it for, what your message is. But there are lots of different ways to do it, and a good starting point would be the Legacy Project.
And also, you know, leaving a legacy doesn't mean that you have to do something tremendous, sure, right? Like, you know, you don't have to cure cancer for that to be your legacy, right? Danielle, I know you pretty well, I think, and you light up the room when you walk in and make everyone feel so welcomed, and you're so kind and thoughtful, and that's an incredible legacy right there, right? The way people feel when they're around you, just because you are you.
May I add something too? Danielle, you should just look at the notes in the database and what people say about you. I haven't heard one person you spoke to who wouldn't say Danielle is wonderful. She helped me so much. Your kindness makes such a difference in everybody. And as you know, when the callers we get need so much of our support, and you help them so much.
So thank you both. There are just a few comments here. Thanks to both speakers. This was incredibly helpful and meaningful. Thank you so much. You're an inspiration. Victoria, you are such a light for our community. Dr. Shaw, this information has been very helpful. Thank you so much. These are comments that listeners have written here. So again, Victoria, Dr. Shaw, thank you so much for this program. Thank you everyone for participating and submitting questions. And if you wouldn't mind just filling out the evaluation form at the end of the webinar, it shall pop up right when the webinar ends. Dr. Shaw, thank you again. We really appreciate your time. Hope you have a nice rest of the evening after your very long day. We appreciate your time with us.
No problem at all.
Victoria, my dear friend, thank you so much for sharing your story.
Thank you for having me and listening to me.
Thank you, everyone. Have a good night.
Night.
Good night.
Bye.